The head of the Center for Disease Control in China claims there may have been asymptomatic cases well before the first instances of the new outbreak, also traced to a whole food market, were recently discovered. The 25 new cases China says were reported last Friday in Beijing were among 32 nationwide, 4 of them in Chinese citizens who had returned from overseas, according to official reports. There is a discussion by Chinese doctors over whether the DNA of COVID-19 in the Beijing outbreak is of a European strain.
They do know that the genetic characteristics of the organism in Beijing this time are different from Beijing a few months ago, which is to do with the organism having mutated.
Chinese officials say containment measures have slowed the momentum of the outbreak, which the government has said infected more than 200 people since earlier in June. In Europe, Germany has also seen a spike in cases after more than 1,500 people at a meatpacking plant had tested positive for the new coronavirus. New lockdown restrictions are being imposed until the end of June as German Red Cross workers in hazmat suits went door to door in Gütersloh on Tuesday to undertake mass testing.
Intensive testing will give us a better picture of the situation.
The news comes as officials in New Zealand reported disappointing news. The country was no longer free of the new coronavirus after 2 women who flew from London to see a dying parent had tested positive. Dr. Mike Ryan heads the World Health Organization's emergencies program.
It is a challenge for all countries, and I think South Korea with other countries demonstrate that even when you get down to very low incidence, you still have to have a very strong public health surveillance system, and you still have to have a very capable public health infrastructure.
Global infections surpassed 9 million this week as Brazil and India grappled with an outbreak in cases, and other hard-hit countries reported new surges, including in some parts of the United States. Mariama Diallo, VOA News.